Awesome. I think we're ready to get started. How's that sound, everyone? It's okay if a few people pop in a little bit late, but yeah, let's go ahead and get started. I want to welcome everyone and thank you for being here. This is a joint lunch and learn between the Youth Pathways Committee and Rapid Illinois. We invite you to join this community of practice event where we'll engage in dialogue around barriers for young people in Chicago throughout their health career pathway. Before we get going, I do want to suggest some group agreements for everyone in this meeting. With a lot of what we do, just lead with humility, curiosity, openness, and understanding. We have a diverse panel, and each person on the panel has a distinct point of view, so let's respect that. I also ask that you please stay on mute until the formal Q&A portion. That will be about the last 20 minutes of the session. That said, feel free to pop into the chat and give kudos. If you hear something you like, give them up one. Even if you have a question, put it in the chat just to remind you when the Q&A comes around. That's totally fine. Also, in the interest of keeping this conversation focused, I do ask that we refrain from any overt sales pitches or overly promotional spiels for our program. There's a time and place for that. This is a peer learning event, and we want to make sure that we maximize the time and keep the conversation focused. So with that, I would like to introduce those that we'll be hearing about. My name is Matt McClintock. I'm a convener of the Youth Pathways Committee, and I put together this panel to discuss barrier reduction through the health career pathway. Natalia, let's start with you. Why don't you introduce yourself and say who you're from?
Yeah, good afternoon, everyone. My name is Natalia Gallegos. I'm the Director of Engagement and Impact for the Rush Education and Career Hub at Rush University Medical Center.
Perfect.
Thank you for having me.
Thanks. Lucretia, why don't you go next?
Hey there, I'm Lucretzia Jamison. I am the Executive Director of Youth Job Center in Chicago and in suburbs. We started in Evanston, now we're a little bit everywhere. And everybody calls me Cree, so you can call me Cree.
Perfect. Thanks, Cree. Chantal, why don't you go next?
Hi, my name is Chantal Rodriguez. I'm currently a sophomore at Northwestern University. I'm a first-gen student. I'm the first person in my family to go to college and kind of experience the college application process in high school, experience in the United States. So yeah, I'm happy to be here and happy to share my experiences.
Thanks, Chantal. Dalia, you're up.
Everyone, my name is Dalia. I'm sorry I don't have a camera on. I'll turn it on in a couple of minutes. I'm just like running around because I'm also working. But yeah, hi, my name is Dalia. I'm a first generation and slash or low income student at Northeastern University in Boston, Massachusetts, where I'm majoring in data science and behavioral neuroscience. And this semester, I'm working at the Center for Genomic Medicine at MGH.
Awesome. Thank you, Dalia, and no worries about the camera. So yeah, as discussed, we're here to talk about barriers and barrier reduction. And when I think about barrier reduction, I think about something that I overheard at a national workforce development conference last year, which is that, the strength of your workforce program really depends on the strength of your wraparound support. And that really got me thinking about a juxtaposition here around wraparound support and barrier reduction, and that, the concept of providing barrier reduction is somewhat ubiquitous in that you see it across so many different education and workforce programs, yet ensuring that each student gets what they need is a highly individualized process. Additionally, wraparound support is needed and hopefully utilized in all sectors, yet there really must be unique supports in place for those in this highly regulated, sort of compliance and liability driven health sector. And I provide these descriptors, highly regulated, compliance, and liability, to show how health sector careers can be especially high barrier to entry. In a liability driven world, what happens when someone who's been justice impacted, for example, tries to gain the necessary credentials to practice community health or public health or healthcare, seeking a career that helps them build thriving wages and wants to give back to their community? We've actually seen this play out recently in our region. The Illinois Community Health Worker Association, affectionately known as ILCHWA, they advocated for a policy position that would remove background checks for state certification for community health workers, thus removing a barrier to work. Ultimately, they lost that fight. And when they talked to the review board around why they weren't able to get their policy position approved, the reason that was cited was liability concerns. So, although that's an important story, I don't want us to get overly focused on that one case. I want to, as I move to moderating this panel and getting the discussion going, I want to recenter and broaden this conversation that we are here to talk about barriers that specifically impact youth seeking pathway programs or careers in the health sciences. And we're here to learn about experts who know this work very well. So, with that, let's move to the discussion. My first question will be for Natalia, and then I'll pass it over to you, Cree. So the question is, how do you survey or collect information from your students on their needs for support? Natalia, we'll have you go first.
Yeah, so it's a long-winded answer, but to keep it really short. So the Rush Education Career Hub actually provides all of our students what we call with the health equity assessment tool. Each of our students get one of these health equity assessment tools, which is pretty much like a link survey that they get upon participation into our program. What ends up happening is they get the assessment, they complete it, and then we have one of our Rush community health workers follow back up with them, depending on reviewing their assessment and figuring out what needs or supports they need have at that time. Depending on the program, also depending on their age, we're also able to provide some additional support. So, for example, we're best known for our high school programming. So we can provide laptops and hotspots, as well as bus cards and transportation, depending on the need. But then we can also go further in detail on support. So if there's a food insecurity or health-related need, we can also support. So we work really closely with our community health workers to really establish that relationship and also that connection. But it first starts off with providing this assessment tool to all of our students as the first step.
That's great. I love using that health equity tool and then leaning on the community health worker model to assess the needs of your students. That's great. Cree, same question for you at Youth Job Center. How do you survey, collect info from your students on their needs for support? Oh, you're muted, Cree.
Can you hear me?
Yes, thank you.
Okay. I had to push it again. So it says my internet is unstable. Technology. But as an independent nonprofit, what we do is we link them with a career coach and we do an assessment. We do an assessment as well. And we look at benefits screening. We actually screen them for benefits and ask them, are they, looking at certain types of benefits? Are they housing insecure? Are they food insecure? We ask them all of these different things, what barriers they want to disclose with us, and they work with their career coach. During their enrollment process, even online, we ask them, are there any barriers to employment that you may need assistance with so that we can make sure we help them with that? If it's academic, we do a basic skills test for barriers and everything to see if you will need support because we have volunteers if they're going through a healthcare field that will help tutor them. We have retired doctors and nurses and everything else so we ask them in the beginning, what are the barriers that they have so that we can address them. We actually choose cash, transportation, and other needs that they may have for training and employment.
Got it. Yeah. Similarly, it sounds like there's a one-to-one matching system in place. But then what I like about that is you
Yes.
allow the students to name their own needs and sort of broaden in that agency there. I like that. Awesome. Next question. This will be for Chantel and Dalia. Okay, so I'm curious. if you can speak sort of representing your peer group about non-traditional barriers, are there barriers out there that you feel like you've seen, you've experienced, you've heard your peers talk about that maybe these assessment tools aren't really screening for? They can be cultural barriers, social barriers, academic, whatever. But yeah, maybe you can help us find out what barriers are we maybe not talking about enough. Chantel, we'll have you go first.
Yeah, I guess non-traditional or the barriers that I've heard that have been talked about is kind of like before this even like assessment process or screening process can go on. I guess it's really like motivating students to even apply. I feel like these benefits aren't really that clear during the application process, or some students might not be aware that they can receive support in transportation or say with like academics or the other benefits you guys mentioned. I feel like sometimes it's not too clear, so students think that they won't have the support they need to be successful in the programs or be able to do the program and still be successful in school or in any other things that they're doing.
Yeah, yeah, thanks for that. Dalia, same question. Can you speak to any non-traditional barriers or, barriers that maybe we're not talking about enough in these spaces?
So I fully agree with Chantal. I feel like, oh, my camera froze. No one look at me. Back. Yeah, I fully agree with what Chantal said. I feel like listing these benefits or ways programs support students would be like more clear in the application process and maybe even in the flyer that's used to promote it. Just because I
Mhm.
know like a lot of the programs I was interested in like high school and even like my early years, my undergrad, because right now I'm a third year. Um, some of these programs I couldn't participate in because I wasn't sure like transportation, like how was I gonna get from point A to point B. Um, if I was struggling in like a certain area, would I receive support and would there be like other people who like understood what I was struggling in, or how I was struggling or like why I was struggling. And I feel like just hearing like the amazing benefits that who was it who just spoke? Like the person who previously spoke like after no before me, listening like to all the benefits sounds amazing, and like an application process that they have, I feel like it should be listed clearly, like what's being offered through that program, and I feel like it would motivate a lot more students to apply because they know they would receive the support that they need.
Yeah. Thank you for that perspective, Dalia. Um, I want to sort of tee up Cree and Natalia here for sort of an addition to that question. And I'll pose it as a two-part question, and you could answer both or one or the other. So, how at your program do you address these non-traditional barriers? And the second part of that question is, do you address the so-called benefits cliff? If so, how is that dealt with? Cree, we'll have you go first for this one.
Can you hear me?
Yeah.
Okay. Well, one of the things is that we fundraise to address barriers. We understand that they're there. We understand that a lot of times they're invisible. We understand sometimes they don't want to be disclosed. And like Dalia said, sometimes if it was upfront and personal, they could see it. And we have taken a lot of surveys from our young people who are in school, trying to figure these things out. Some actually want to be in healthcare and haven't made it where they feel confident that they can take on the classes and the courses. So we kind of put it up in the front and say, these are some of the things that we need to do before they even get here. We need to fundraise for this to meet those non-traditional barriers so that they know that, you may have a language barrier. You may need an interpreter. I was a former dean of a program where we had to have someone in the class because we had a student that was deaf. So when you can't hear, although you have, your devices, you may need an interpreter right with you. So bringing the barrier up close and personal and saying, these are some of the barriers our students have dealt with, and these are some of the things that we have done already upfront in order to address them. So we do fundraise for them. We write grants for them. We work with different nonprofits as we built a barrier reduction network for some of the things
Mm,
that we do not do well. We can't handle your child care, but we have a official MOU with another nonprofit or different, daycares in order to say that, hey, let's get you over to someone to get you connected with that.
yeah. Yeah, thanks for that, Kree. I'm glad you brought in that sort of relying on strong partnerships to
Yeah.
reduce barriers. And then
I
I,
think a
I
barrier
also,
reduction network is the key thing because you may not be able to do everything well. A lot of nonprofits or schools can handle transportation, they can handle mental wellness, they can handle different things, but they may not be able to handle um, just as involved, challenges. They may not be able to childcare. So you need to lean on your partners in order to, be able to create the opportunity to solve.
yeah, absolutely. Natalia, if you have something to share on this sort of non-traditional invisible barriers, having that network, go ahead.
Yeah, and I love Creed. I want to learn more about this non or this traditional barrier network that you were mentioning. But yeah, for Rush specifically, we do, like we mentioned, we try to address the issue at the beginning as soon as the students are enrolled in our programming. So we have those conversations upon enrollment and then actually upon before we provide the actual assessment to them as well. But Dalia and Chantal, you made a good point of actually communicating that before they apply, because I think that's also really important for us to think about. But we also one thing to kind of share what spurred this wraparound supports for Reach
Yeah.
specifically is COVID. And so during the pandemic, we are required by CMS to provide a social determinants of health screener to all of our patients. We took that screener and then kind of reformatted it and morphed it into what it is today, our health equity assessment tool to our students. And so kind of that's what spurred that. So we do utilize like our internal Rush SDOH screener, and then the partner that we use on the back end, which is called Unite Us. So Unite Us looks at, all resources across not only the city of Chicago, but they're a national organization that pulls resources, anything from transportation, childcare, housing, food insecurity. And so what we do is we go based on the student and what barrier they do have and have a need. And we work directly with them with that CHW. So we try to use our larger internal partner network with Unite Us and our larger tool. But I think there's also there's great opportunity to learn more about how we can do things differently. The one thing that we have learned too is the more conversation we have with our students and be able to kind of sit down with them one-on-one through the interview process and the acceptance process, we are able to kind of really figure out what needs and barriers they do have to better support them during their time here at Rush. So it is providing, an aide or an interpreter if needed, or giving them extra classroom time if support is needed as well. And then being mindful of their transportation too. If that is an issue, then how do we calculate their time coming into from campus for our programming as well?
Matt, I forgot to mention this in regards to the benefits cliff. There is a key thing to do with partnering and building funding with corporate, building funding with employers, building
Mm,
funding with grants, because a lot of times that benefits cliff is real where someone
yeah.
is afraid to lose their benefits if they get a little bump or they get they get some financial aid or someone is giving them some type of special benefit. So we do a lot of unrestricted fundraising so that
Mhm.
we can help them without it being a government assistance situation. So we do a lot of grants that are foundation grants to support young people going to college or going to a training program. So they're not worried about losing their SNAP benefits because they got an increase somewhere else. So I think a lot of, like I said, the partnering, unrestricted funding, and partnering with corporate America and funders and private funders is really beneficial with letting them know how important it is to support students as they go along.
Yeah, absolutely. That's really great information to have, I think, for everyone at this conversation. I want to circle back to that eventually, but I do want to hear from our Youth Advisory Council members, Dalia and Chantel. Um, just on this subject of organizations working together and sort of just coordinating that, I mean, you're both students, you're both highly involved in extracurriculars, as I understand it. I believe you've both done these health pathway programs. I mean, how can your academic institution work more effectively with community partners to understand and meet the needs of their participants? Dalia, we'll have you go first on this one.
Sorry, can you repeat the question? The Wi-Fi, my school has been in and
Oh,
out this whole month.
no worries. The question is, how can your academic institution more effectively partner with community organizations to both learn about and meet the needs of their students? Just on this subject of, coordinating across agencies.
Specifically for my institution, I feel like my institution doesn't do the best collaborating or like with collaborating with community partners. So most of the work being done are the community partners themselves, like partnering up with other community
Hmm.
resources in the Boston and Massachusetts area. And I really wish my school would be part of that so they can get like more students involved in like these resources, especially first gen and slash low income students. I'm the president of U-First, which is a student-led organization that aims to close the information and support gap for first generation and low-income students. And some of the ways we do this is by sharing resources about like community resources, like I mentioned. And I feel like if my school like would like our organization or like as a whole and like would create like a shared resource, these resources, and like talking about it like in like big school events and showing students that these resources are there for them without making like the first or like coming from a low income background, being seen as like having like a negative connotation. I feel like it would be a lot better Christian. And like any student in general, who's like struggling and doesn't necessarily have like the first portion within their identification as a student. I think it would be really good. But yeah, I really wish my school would partner up more with community partners and would share.
Yeah. Yeah, I'm hearing making those partnerships a little bit more explicit. And then, yeah, this subject touching on like, how do we talk about first generation students and what's the perception of that across campus or with the community partners or whatever? Thanks for sharing that. Chantal, same question for you. How do you wish your academic institution partnered with community orgs to understand and meet the needs of their students?
Yeah, I guess like with community orgs kind of outside the institution, what I've seen that has been really successful is clubs at our school or students in our school reach out to organizations and they work together to kind of make a club around organization. Or what I'm thinking of specifically is this one club at my school that partners with the clinic, and the club essentially like recruits students and they work with the clinic and talk with them and like have them come to campus and give like an orientation session of how the clinic works. And it gets students like really involved with the clinic just because representatives from that clinic are coming to campus, and then we're also seeing students who are volunteering there share their experiences. So I think something that would be better would be seeing more of that, seeing more organizations work with students to maybe like find clubs or just have students promote their programs or the stuff they're doing, because personally that's just how I've gotten involved in campus a lot and heard about the opportunities around me during college.
Yeah. Yeah, understood. We use this term in education, workforce, or whatever all the time. Meet the students where they're at. And I think that should be taken literally. Literally go to where the students are and promote your programs and let them know what's out there. Awesome. Thank you for sharing all that. I want to stick with this subject of engaging external partners. And this question is for Cree at Youth Job Center. And then I will loop you in as well, Natalia. So, Cree, a big barrier is getting youth hired in healthcare when they don't have certain certifications or degrees. Can you talk a little bit about how you've engaged employers and if you've seen any practice change from employers on this subject of getting youth hired in the health sector?
Yes, so we are in the business of getting young people hired in healthcare. So that's one thing that so many young people are coming to us wanting to do. But that is the other thing. They're saying, oh my gosh, I don't have the credential, I don't have the degree. The one thing we have done is, like I said, we write grants. We're a WIOA partner, which is a federal grant to get young people trained and get them a credential in healthcare. So you use those federal dollars to do that. We also do a partnership where we do paid work experiences that will
Mm,
help the young person become more familiar with the work. Because I always say there's a difference between eligibility and suitability. They may not be
mm.
suitable for the job. They may say, "Oh my God, I want to be a nurse." As soon as they start looking at blood, they're, running around and, avoiding class. And so we try to make sure that they have a suitable situation. So we put them through a paid work experiences, working with hospitals to say, or clinics to say, hey, we will take this on. We've raised the money. We've gotten this money to do a paid work experience. I'm asking you as a subsidized opportunity for you to take this young person on, teach them some skills for a few months, see what they can do, and if it's something that you believe in, take them on permanently. And that
Yeah.
really helps hospitals and clinics say, "Oh my gosh, it wasn't that bad." They I was able to get them in. They know the work, and here they are, and we can get them hired permanently. We also build partnerships with healthcare systems. Currently, are with Endeavor Health. We are working with Northwestern Medicine. They have a youth program in Northwestern Medicine where they started to develop in their HR departments small ways of figuring out how to connect with more entry level positions and young people that are looking to do this. So I think one thing is to connect them with the work, help them get the credential, make sure that they have the opportunities to train, subsidize, and then work
Mm,
as a partner to maybe connect them with an unsubsidized opportunity. The other thing
mm,
is we have volunteers who have worked in healthcare to help prepare our young people for the type of interviews, the type of environment that they're walking into. So utilizing your healthcare retirees or those who want to volunteer to say, let's
mm.
help these students, current students, get into this opportunity.
That's great. I love that you're utilizing volunteers as mentors. And then, in workforce development, we do have to make that case for the bottom line for employers.
Yeah, we
And
do.
so I like that you brought in that subsidized opportunity. And then it touches a little bit on that sort of risk calculation that we know employers are always doing.
Exactly.
Um, Natalia, same question for you. Whether it's sort of working across departments at Rush, if that's with HR, or I'm kind of thinking about it in terms of how Rush conceptualizes your youth outreach, wraparound support as sort of cultivating a talent pipeline long term. Maybe you could talk a little bit about that.
Yeah, I'm happy to. Yeah, I will say the Rush Education and Career Hub specifically is very niche in the sense that we are an intermediary, but we sit in this larger employer, which is known as the medical center. Um, we kind of see ourselves as a more of like a non-for-profit run, but very aligned to the employer, which is a larger Rush. So very similar to what Cree mentioned, we provide students through our programming, specifically high school and college age, provide students not only are they participating in our programming, but they're actually getting hired on by Rush. So that provides like that first step or entry point into the system and the employer. So they are hired in as part-time students, depending on the program and the level of the program. We have a specific like hour amount of time that they spend here on campus. Um, because they're employed and part-time employed, they also reap the benefits of Rush's employer benefits as well. So that's another additive to kind of how we support the student. The other thing to be mindful is all of our programming, specifically for high school and college, provide industry recognized credentials. And I apologize if I'm
Hmm.
getting a little out of this right now, but we provide industry recognized credentials that are stackable credentials and are entry level credentials at Rush. And we very much align it to opportunities or gaps that we have in our current system, right? So
Hmm.
we have a high increase of, PCT need at Rush, so patient care techs at Rush, whether that be at our medical center or at Rush Oak Park. We have a high demand of MAs as well, medical assistants. We provide a phlebotomy and ECG certification, which gives the students the opportunity once they're done with their programming to actually go into a specific job opening at Rush. The other supports we've kind of built in more internally. So looking at, we recently hired a career development manager that is very much aligned with, he sits within our office, but is very much aligned with our HR department and connects directly to our HR recruiters, recommends students directly to our HR recruiters for positions, and then they kind of take it there from there. So it is a pipeline. We do work also very closely with our larger HR workforce development team. They're working internally at a larger scale of how they move workforce development along. And we're making sure that our students and our participants are actually involved in those conversations. So we have
Hmm.
a seat at the table, right? So it's not only thinking about our employees that may be an entry level, but our students that are also coming out of our programming with certifications that they can move into that. And we always tell our HR department too that, hey, we do all the hiring, vetting, getting them through the door. We just need to transfer them into a position that is
Yeah.
open and available. So we do kind of the lift to support our students. And so that's kind of how we work internally with what we have right now.
Hmm. Understood. Yeah. Quick follow-up question. I mean, is that something that your HR department quickly agrees to? Did that take a lot of convincing? I mean, what was it like really, because you're doing such great work and it's so ambitious. Is it difficult to sort of sell your leadership or your HR department on that work that you're doing?
I will say it has been a lift.
Yeah.
And it is a continuous working relationship that we have between our leaders. I think what is beneficial to us is that our executive director, Rakia Carvey Johnson, who sits as our executive director, is also the vice president of community health equity at Rush. So she kind of has the ability to play both parts. And we definitely have direct connections with our HR leaders. I think where it can get challenging and difficult is that sometimes we just have a lot of a revolving door with our HR recruiters, right? So it's kind of getting our HR recruiters up to speed on what we do and who we are, to kind of make sure that we don't lose a student or someone doesn't get lost in the referral process internally. But we stay very much involved in the larger workforce development. So for example, my team of five, three out of the five are actually sitting with workforce development in meetings and
Mhm.
having conversations and pushing things along, specifically our career development manager. So yeah, so it's taken some
Yeah.
time. I've been at Rush for 7 years, and I would say in the last year and a half, this has been a larger push and commitment across our leadership, and then our involvement as well has been helpful.
Yeah, that's great. Well, congratulations on sort of successfully implementing that paradigm shift with your leadership. And yeah, it's a great point to make sure, the right people are at the table in the meetings having those discussions, whether it's frontline or sort of interdepartmental collaboration. That's great. So I'll suggest a question again for Chantal and Dalia. If you could sort of speak from a place of self, what's one challenge or barrier that you've experienced, and how did you overcome that? Chantal, we'll have you go first on this one.
Yeah, I guess like the first things that come to mind was sort of just learning about all these opportunities. I know I mentioned this a bit earlier before too, but just personally, like I'm the oldest in my family. I'm quite literally the first person who went to high school in the US, who applied to
Mm.
college in the US. So throughout high school, it was really just like hearing about all these opportunities, like I had no idea I could go volunteer at a hospital during high school or join a research program with the university. That was all new to me. I just didn't know was a thing. What really helped me out was that I had a friend who had an older sibling who was also interested in medicine. So she was the one who told me about these programs. And once I was in these programs, that's when I learned about all these other opportunities. But yeah, like thinking back about it, if I didn't have that one friend or that one connection, I wouldn't have done as many things as I would have or could have done. And yeah. So, and I know that's also like a barrier that a lot of other people face too. And then other than that, just generally like, I guess this is more like on a personal level, but just like imposter syndrome or
Please.
confidence that like I can actually do these programs at these and that these programs are for me just because I don't really have a mentor in my family or a friend who can like who is that representation who made it into medical school or in the healthcare field that like can show me like, hey, it is possible. So yeah, just like that mentorship um I guess need I like it was one of the barriers that I initially had during high school, and then once I entered these programs and got that, I it's what helped me succeed. Um, but yeah, I'd say like those are the two things that come up to mind at least at first.
Yeah, yeah. Thanks for sharing that. Dalia, same question for you. What is one challenge or barrier you faced, and how did you overcome that?
Challenge I faced or barrier has been filling out these applications. I fully agree with what Chantal said. As a first gen, a student who comes from an under-resourced neighborhood, community, and underfunded school, this this wasn't really like pushed upon us. Like their main goal was just like have us graduate. So when I was learning about like these programs, through a program that I stumbled across, just like how did I stumble? I applied to this program called the Medicina Academy Apprentice Program, also in the UIC. And they offer it from 10th grade through 12th grade, so like sophomore through senior year of high school. And the only reason I stumbled across it was because one of my friends' older sibling was part of the program, and they were applying for it, like the program, because you have to apply. So like they shared this information with me because they also knew that I wanted to do something like medicine related. Then we were
Yeah.
both like applying for this application. Like their application was like really well polished, and I was like, oh, like how did you know you had to like include like these keywords and like filling out the essays? Like how do you send an email? Um, like a teacher for like a letter of recommendation. Um, like how do I get a hold of my transcripts? Like just learning this like every step of the way. I feel like yeah, like, filling out these applications and just like asking for help has been was like an issue that I had in high school and like my first year of college. But through like this amazing program, the Medicina Academy Apprentice Program, I was able to have access to mentors and professionals who guided me throughout high school and college, and were able to teach me like the key things I needed to include when applying to certain programs.
Yeah. Yeah. Thanks for sharing that. Oh, Chantal, do you have something to add?
Yeah, I guess just something sort of related. I feel like sometimes some things are sort of overlooked in how to fully take advantage of opportunities too. And this was just something I was thinking of recently. Like during high school when I was in programs, a lot of programs would bring in like a speakers and like I would just kind of sit there and listen and be like, wow, that's so cool. Leave it like that. But I didn't know I could have like asked for their contact information or their LinkedIn and connect with them. And then if they were a doctor, maybe I could chat with them. I feel like sometimes we're not really taught how to fully take advantage of opportunities just
Mhm.
because it's our first time in these types of settings. But yeah, just to like add on to what Dalia was saying.
Yeah, no, I'm glad you took the conversation there because as both of you were speaking, I was thinking like I've worked with you a lot and you're both stellar students and I've also worked with well stellar people, not just students, but I've worked with the Youth Pathways Committee a lot too, and those are all individuals who are very motivated to work with youth. So I want to encourage Chantal and Dahlia to share your LinkedIn, share your contact information, and same with the professionals in this room. Share your information and really engage meaningfully and directly with our Youth Advisory Council to directly provide them support if and when that's needed and appropriate, of course. So I just want to offer that up as a sort of connector between the two groups here. Um, and your comments got me thinking a little bit too. And this will be the last question for me, and then I'll turn it over to the group. But Kree, I want to hear from you first, and then we'll bounce it over to Natalia. And the question is, How do you address the needs of the whole family or the parents, when you're working with barrier reduction for youth? Is it a similar screening? What is that like?
Well, for us, we like I said, we have a barrier reduction network, but we
Yeah.
also have certain grants and certain opportunities. We don't turn anyone away. Being a nonprofit, we're able to work with everybody and figure out, how to help. If it's financial, we can work with, we have lending circles, for example. We teach young
Mm.
people how to, borrow some money if their car is broke down and they've put in this little savings pot. But their families can also join that as well. We have lending circles where the parent can join. They can be an adult. So although we're a youth focused organization to 25, if there's someone that's above that age, we're able to help or able to refer. The other thing is ensuring that we have protection over those benefits, because I'll tell you this, we've often had situations where parents were upset because a young person is going to school, which is a hidden barrier no one ever thinks about. If the parents have benefits and then their child goes on to school and starts getting benefits, it takes away from their benefits. So we
Mm.
do a lot of benefits, have opportunities for families to connect with different things. If it's talking about workforce, we have partnerships with our American Job Centers where the parent can actually have the exact same services that the young person has, but you have to keep yourself well informed of what's going on around town, basically. So that's one thing that we definitely do. I was one of those young people that was so uninformed. I was a first generation college student as well. And my mom didn't know a lot of the things that were happening. So when we were connected with nonprofits or barrier services organizations, they were able to help my mom as well. So oftentimes you need to have either the link or the ability to help the parent and to help the family do that. When you're talking about childcare, being able to get the childcare covered. So now that the student, if she's a parenting or he or she is a parenting youth, they're able to go to college, but the finances is covered. It helps the whole family. So even if you're for one direct population, you need to have enough knowledge or skill base or relationships to help, to help other duties as assigned.
Yeah, yeah, absolutely. Thanks for sharing all that, Cree, and thank you for teaching us about another one of those invisible barriers that I certainly
Yeah,
wasn't aware of.
yeah.
Natalia, same question for you. How do you engage the family? How do you think about wraparound support or barrier reduction for the family, caregivers, that two-gen approach we talk a little bit about?
Yeah, so we kind of follow the same as well as Creed, in the fact that we do have the students. It really should be student and parent as they complete the assessment, but sometimes the students will do it on their own. Um, but we do have a follow up with the students as the parents as well. Specifically, we have opportunities to engage our parents, whether that's like through our newsletter or our through our orientation process, onboarding process with our students and families. So we provide that screener tool and the ability for the parents to do it on their own time, and then we follow up. The only difference that we do is that if a parent or family member would like to continue those services or working directly with our community health worker, they kind of
Mhm.
do it outside of what we provide and they continue that relationship moving forward. So technically, if the student is no longer in our programming, but the parent or family is still needing that assistance outside of the
Mhm.
period of our program, they can still continue that. It's
Mhm.
just categorized as like community health worker hub, community focus rather than
Mhm.
hospital or reach programmatic specifically. So they can still continue that. The other thing we've created through the same process is writing grants and getting grant funding for some of this work is we created an emergency assistance fund, which is
Mhm.
specific dollars that we allocate for specific needs. So whether that's a utility bill or college books or rent or your car broke down, and you need just additional help, the student or parent or family member could complete that. And then we have like an internal committee that goes through the process and reviews it and then provides those funding supports. So we have a specific, like in a sense, bucket of opportunity for our funded, and it could be donor foundation, that we have that set aside just for those specific emergency needs.
Yeah,
Yeah.
yeah, that's great. And yeah, I just want to sort of call out that through line of fundraising that you brought up, philanthropic and corporate fundraising for this emergency fund. And then Cree, you brought up this notion of giving circles or lending circles. And so just, yeah, I just want to uplift that for those of us in the room that write grants are sometimes responsible for fundraising, whatever it is. Great. I'd like to open it up to the crowd here, all of our participants, to ask any questions that have been on your mind, whether it's something you wanted to hear before the session, something that has come up during the session. And conversely, I want to provide Chantal and Dalia an opportunity if you all have questions for some of the adults, or I shouldn't say adults, some of the professionals in the room. You know, uh, that's fair game too. So I'll put myself on mute and I'll let someone else speak up.
Hi, I'll chime in. My name is Michelle Hathaway from UIC Rapid Illinois program. It's so great to see everyone. So impressive. This has been so informative. So thank you to all the panelists. My question is, for, let's say, organizations or pathway programs that are more that are small. Maybe they don't have the infrastructure, that Youth Job Center has or that Rush has. Um, what recommendations or what starting point would you say for somebody who, maybe doesn't have a grant writer, a separate grant writer to kind of go after some of those funds, but they're trying to pull together a program, really grassroots, but they want to be able to meet the needs, these wraparound support needs of students. What would kind of be like a starting point recommendation for, if I was that person operating, let's say, one pathway program and I'm this small group, what would you recommend as a place to start to meet those students' needs?
But what I would suggest is number one, wait, my internet is unstable. It had to be today. Okay. So I would recommend sub-awarding, being a sub-grantee of larger organizations and seeing if you do the work already. There are a lot of large organizations that have money, but they don't have the manpower at more of a grassroots level, and there can be a really good connection to helping them do the work. We started off with a bunch of grants that we were helping do the work first, and then we grew it a little bit, got our, foot in the game, and then we started applying for those grants. I would also say foundations. Foundations are really a really good starting point. A lot of the federal dollars go to the big brothers, big sisters, and your metropolitan family services and your this and that. But a lot of foundations believe in working with small orgs to make sure that they can really get out a good connection to people who are at risk. And they often focus on people who have funding under 2.5 million or under 5 million and things like that. So I really think about foundations, sub awards, and then also doing partnering with your community organizations to do partnerships with them and co-grants. So you can co-write a grant with other small nonprofits and can give you a little bit more leverage because they're really excited to hear about cooperative learning and work from other nonprofits.
Yeah, I would say the same thing. We started, this wraparound supports based on a funding grant that we had from a foundation that we added just like a line to address additional support to our students that then evolved to what it is today. And technically, I know we are, Reach is under Rush, but we work really, I don't, our CHWs are not directly under my group or our team. It's actually, we kind of, in a sense, borrow time from our CHW hub to have someone with us. So that's a partnership in itself too. So I would also look at like community-based organizations or that are doing health related. So I think of like a Alivio Medical Center that has a CHW worker hub that may be able to partner with a smaller organization that is doing one-off programs so they can provide support. It may be not just student specific, it may be the family led, but it's an opportunity to kind of have and create some of that partnership within the community organizations that are already doing it. But yeah, you start small. I think there's always an opportunity to add it into your grant that you may already have in place that's funding your work already. And I'm seeing that more and more as we write new grants. They're always looking for now how are you supporting students' needs or their barriers and what are you doing to address that? So that's a perfect opportunity to include some of that in that.
Thank you both so much.
Any other questions from the crowd? Go ahead, Sean.
Yeah, I had a quick question for Natalia. I know you mentioned earlier how your programs, they give students certifications and they give them the opportunity to actually be employed with Rush. I was just curious, how do you guys work around like student schedules? I mean, especially like with high schoolers, they're in school from like 8 to 3, or they might not live close to the hospital or location they can work at. So I was just curious how you guys work around that.
Yeah, so we do it all. What we're mostly known for is our high school and college programming, which I kind of been reiterating throughout the conversation. But we do have our summer programming. Most of the students that come in for our breach programming is over the summer. So it's 6 weeks for our high school and 8 weeks for our college program. We really make sure to work it really closely with CPS ending and CPS starting fitted into that. But we also do stuff throughout the year, right? So senior experience, your CPS provides senior experience opportunities through CTE. We get students to come in and rotate through the hospital during their senior experience needs as well. But most of our programs are tailored over the summer. Now, our apprenticeship programs are more of like a self-paced. So if we think about our interpreter services or our pharmacy tech apprenticeships, we kind of are self-paced where we work with the students in the evenings and the weekends to kind of work around your schedules. But it depends on the program. Every program is a little different depending on the timing of the year and the length of the program. But yes, we understand that, yes, priority is school. And so we try to work around those schedules to make sure that we have the programming run outside of the school day if needed.
You know what? I will add that if you do know any high school young people, they can always check. There's usually a 2+2 program where there's early college. So there's dual enrollment, dual credit, where they embed those classes in the high school where they can get college credit as they go along and actually credential them while they're in high school or have more credits to go to college. So it can help with the scheduling and their responsibilities while they're in high school. So there's always those opportunities of dual enrollment, dual credit. They can also go to that college and go from the time of 4 to 7. They have special classes for high school students that they can take college credit at the college during their time throughout the year. So if you know of anyone that's always check the early college program, and it's dual enrollment, dual credit.
Thank you so much. That was really helpful. I also have to step out now. Thank you everyone for speaking. I thank you for letting me be here and talk about my experiences. I learned a lot, and yeah, I hope everyone has a good rest of their days. Thank you.
Thank you, Chantal. Thanks for being here. Awesome. We might have time for one or two more questions. Let's hear from others in the group.
I do have to step out too. I'm sorry. But thank you so much for having us, ma'am. I'll also drop my LinkedIn in the chat in case anyone wants to connect. and continuous conversation after the meeting. Thank you so much again for listening to me and Chantal, and I hope to see you guys soon.
Of course, Dalia, thank you for being here. Really appreciate your insights, your perspective, and thanks for dropping that LinkedIn. Appreciate you, and we'll be in touch. Great. All right. With that, yeah, we'll wrap this up. Want to thank everyone for being here. Big thank you to our panelists, Lucretzia and Natalia. I really appreciate those insights that you shared. I certainly learned so much today, and I hope that's the case for our audience. And thank you for everyone for participating and listening to the great topics that our panelists had to share. So with that, I'll be in touch with everyone. You'll be hearing from me, and have a great rest of your day.
Thank you all.